Hi, this is Dr. John Preston from Reliant International University in San Francisco. And in 1978, Dr. Hall and colleagues did a landmark study where they looked at 658 consecutive outpatient psychiatric patients. And what they did is they did medical screening on all of these people. And this is something that's rarely done in psychiatric settings. What they found was that 9% of these people, it turned out, had an underlying medical condition that was solely responsible for creating their symptoms of depression, anxiety, and so forth. And 75% of these people didn't have a clue that they were medically ill. Other studies have occurred since then, but none as large a sample size, and the results are almost identical. A large number of people seeking out psychotherapy and other kinds of psychiatric treatment, in fact, the cause is due to an underlying and unrecognized medical condition. I want to tell you about one of my patients. This was from years ago, and all of us clinicians learn our best lessons by the failures that we make ourselves. This man came to see me 25 years ago. I was working in an HMO setting, and this man had extremely severe depression and anxiety. The onset of this was 2 months before he came in to see me. He'd had a tragedy in his life where his wife, in her early 30s, had died in a car wreck. He had 3 young children, and the entire family were experiencing a huge catastrophe, and this man slipped into a very severe, agitated depression. This man had lost 12 pounds in the last 2 months. He wasn't sleeping. He developed severe anhedonia, was having some suicidal ideas, and a whole array of diagnostic symptoms that would suggest clearly major depressive disorder. So for treatment, he entered a bereavement support group, which seemed appropriate, was seen once-a-week psychotherapy, and was treated with antidepressant medications. The antidepressant treatment was aggressive in nature, adequate doses. When the first drug didn't work, it was switched to a different antidepressant. He complied with medication treatment, yet he didn't get any better. 10 weeks passed, and this man was no better. And he came in to see me, and they told me, Dr. Preston, now guess what? I have thyroid disease. And immediately what entered my mind was one of my professors at Baylor University when I was in grad school said to us, y'all remember dogs can have fleas and ticks. And this man suffered for 10 weeks needlessly because of the stupid mistake that I made. And the particular kind of stupidity I'm talking about is thinking in simple-minded kind of ways. Clearly, he had a significant psychological stressor, and in the wake of this, developed severe depression. But it just so happened he also had hyperthyroid disease that began to come into full bloom about the same time. It's absolutely essential that we always be thinking multidimensionally. With mood disorders, it's always appropriate to get at least 2 laboratory tests, a complete blood count, and this is going to pick up possible anemia. A lot of anergic, lethargic depressions can look very similar to the kind of fatigue that you get with anemia, so that'll screen for that. And the other is the thyroid panel. This man then was treated medically for his hyperthyroid, made a good recovery, and with continued psychotherapy and antidepressant medications, within 2 months was fully recovered. He suffered needlessly because of my not thinking multidimensionally. Thanks for listening.